It's supposed to be one of the most effective forms of permanent birth control. It is called Assure, and it's considered a less invasive procedure for women rather than having their tubes tied or undergoing a hysterectomy.
But as 11 at 11's Claudia Coffey discovered, thousands of women are having irreversible side effects: nausea, pain, depression, some even getting pregnant after it's implanted.
All the women I spoke to named the same exact symptoms: nausea, pain, depression, even some getting pregnant after it was implanted. But so far, those symptoms have not been officially linked to the product. It's a mommy's club that these women never expected to be a part of. They all met on Facebook, but not for a reason any of them saw coming. All had the permanent birth control device Essure. Then all of them started having what they called horrible side effects.
When you first wake up, it feels like you were absolutely hit by a Mack truck. I'm not kidding. Your whole body hurts.
Bloating, headaches, nausea, all the time.
You feel nauseous all the time?
Yes. Every day. Every day. There's many times that I actually have to take medicine so I don't get sick.
I've got like this nerve down my right leg. It's so painful that it's like just shooting pains all down my leg.
It is a story we heard over and over from women that contacted WHAS 11. These women from across Kentuckiana say Essure sounded like a perfect fit for them. The women all have kids and wanted a permanent birth control, but one that was not so invasive as others. This was something that could be done in the office, less than an hour, then you're back at home or work. But they say as little as 3 months later, painful problems began. Christy Lee from Fairdale suffered massive bleeding, an infection, and even had to be hospitalized.
I've been to the clinic many times over the pain, infections that I've had, heavy bleeding for months at a time. I've actually had to be put on birth control to control the bleeding.
Kira Abrams from Cincinnati suffers from constant anxiety, depression, back pain, and fatigue. And then one of the coils actually came out. This is the picture of the ultrasound.
But my left one fell out, so I had to get a second one injected in my left side.
Angie Mither probably got the biggest shock of all, less than a year after getting Essure.
So I went in the hospital, and that's when she did an ultrasound and said that I was pregnant. And then I got in a fetal position and was like just so shocked. And then she said, "Oh, there's another one." And I mean, it was just, wow, twins, 2 stacks.
Essure is a non-surgical procedure. It deploys using a small coil-like device that is inserted into the fallopian tubes. Those coils contain fibers which trigger inflammation, then scarring, which seals off tubes in 2 to 3 months. Conceptus first owned Essure, and it lined up celebrity spokespeople to endorse it, like Bachelorette Trista Sutter.
I didn't want that fear anymore. I just wanted the peace of mind.
All of the women we spoke to went back to their doctors to complain, but their concerns, they say, fell on deaf ears. But soon they learned they were not alone. Thousands of women are complaining of the same problems. They even have a Facebook page and a well-known attorney on their side. Erin Brockovich has launched a petition to start a class action lawsuit. For these women, this was the answer they've been waiting for.
But the other symptoms that I have are terrible, terrible, and they totally take away from your quality of life. When they put these in us, it killed us. It really killed us.
You have to select the right patient.
U of L OBGYN Dr. Tanya Franklin does not treat any of these women. She says she has performed it on at least 20 of her patients, and none have had problems.
Well, the risk associated with having an Essure placed is going to be the same risk associated with having any kind of surgical procedure. There's risk of bleeding, there's risk of infection, there's risk of damage to the fallopian tubes or damage to the uterus. Those don't change. I think a lot of the complaints from women are around side effects that you would normally see with any kind of procedure.
Essure has since been sold to Bayer, and they issued this statement. At Bayer, we care about patients and take the safety of our products very seriously. We are saddened to hear of any serious health condition affecting a patient using one of our products, irrespective of the cause. Essure was approved by the FDA in 2002 and has a well-documented benefit-risk profile. But for Kira, Christy, and Angie, they feel like they are faced with either lifelong pain or being forced to get a hysterectomy, not something they imagined undergoing at their age.
If you just get them out of me, I'll be the happiest person alive. If you just take them out of me. That's all I'm asking you to do.
Essure can be reversed, but it is costly. It can cost anywhere from $4,000 to $6,000. Claudia Coffey, WHAS 11 News.